COPD, management of exacerbation. An exacerbation of COPD is difficult to diagnose, but signs and symptoms may include increased dyspnea, increased sputum production and prurulence, respiratory failure, changes in mental status or worsening blood gas abnormalities. Primary cause for an acute exacerbation include tracheobronchial infection and air pollution. Secondary causes are pneumonia, pulmonary embolism, pneumothorax, rib fractures or chest trauma, inappropriate use of sedative, opioid or beta blocking agents, and right or left sided heart failure. First, the primary cause of the exacerbation is identified and then specific treatment is administered. Optimization of bronchodilator medications is the first line therapy and involves identifying the best medication or combinations of medications taken on a regular schedule for that patient. Depending on the signs and symptoms, corticosteroids, antibiotic agents, oxygen therapy, and intensive respiratory interventions may also be used. Indications for hospitalization of a patient with an acute exacerbation of COPD include severe dyspnea that does not respond adequately to initial therapy, confusion or lethargy, respiratory muscle fatigue, paradoxical chest wall movement, peripheral edema, worsening or new onset of central cyanosis, persistent or worsening hypoxemia, and or need for non-invasive or invasive assisted mechanical ventilation. Oxygen therapy. Oxygen therapy can be administered as long-term continuous therapy during exercise or to prevent acute dyspnea. Indications for oxygen supplementation include PaO2 of 55 mm of mercury or less, or evidence of tissue hypoxia and organ damage such as carpulmonale, secondary polycythemia, edema from right side heart failure, or impaired mental status. In patients with excessive induced hypoxemia, oxygen supplementation during exercise can improve performance. Patients who are hypoxemic while awake are likely to be so during sleep. Therefore, nighttime oxygen therapy is recommended as well, and the prescription for oxygen therapy is for continuous 24-hour use. Intermittent oxygen therapy is indicated for those who desaturate only during exercise or sleep. The alert: because hypoxemia stimulates respiration in the patient with severe COPD, increasing the oxygen flow to a high rate may greatly raise the patient's blood oxygen level. At the same time, this will suppress the respiratory drive, causing increased retention of carbon dioxide and CO2 narcosis. So, the nurse should closely monitor the patient's respiratory response to oxygen administration via physical assessment, pulse oximetry, and or arterial blood gases. Thank you.